National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, health expert here at nationalnutrition.ca. In my office, I encounter patients suffering from osteopenia and osteoporosis on a regular basis. What these conditions are is essentially different ways of describing levels of bone loss that somebody's experiencing. And often their primary treatment is a medication called a bisphosphonate. And what these drugs do is they actually change the way in which bone remodels. See, we often talk about bone as if it's a dead tissue, when in fact it's a very living tissue. It's actually involved in making a lot of your immune system cells, what we call your B cells, are created in your bone marrow, as well too. There's active construction and destruction going on in the bones at all time. If the bone wasn't a living tissue, if you fractured it, it wouldn't repair itself. And so of course the fact that we can heal from a fracture just goes to demonstrate how alive the bone actually is. Now, every day, to accommodate for the different types of stresses that can affect the bone, your bone is actually remodeling itself at all times to ensure it's as strong as it possibly can be. Every day it breaks itself down a little bit and it builds itself up a little bit. And this is what leads to normal bone function, normal bone health. Now, over time, due to a variety of other diseases, you can get excessive bone loss, and this is what we characterize as osteopenia, and then at its more severe form, we call this osteoporosis. And so your doctor may approach you and say, you know what, you're osteopenic or you're osteoporotic. What I want you to try is this medication called a bisphosphonate. And if you're not sure if the medication the doctor has given you for osteopenia or osteoporosis is this class of medicines, just give their office a call or call your pharmacist and ask, because there may be better options out there for you. And I'm going to explain why. See, the trouble that I have with bisphosphonates is that these drugs impair the body's ability to break down bone. And that may seem like something very beneficial, but what actually happens is that the bone becomes thicker but more brittle. See, the bone's strength comes from the fact that it's hollow. The unique structure of the crystals of the bone is what provides the bone to have what we call tensile strength. So it's what dictates its ability to resist a fracture. And so just because these medications increase the bone thickness, they give people a false sense of security that they're actually less likely to have a fracture. When in fact, research has actually shown that oftentimes, especially in women, these drugs can actually lead to an increased risk of a fracture of the long bone of the leg called the femur. So here you have a case where even though the bone mineral density may be improved, the bones become more brittle and can actually be more at risk of a fracture. And that's the whole thing we're trying to stop by limiting osteopenia and osteoporosis in the first place. So you're looking at a medication that comes with a variety of side effects and may actually cause more harm than benefit. I'm not an anti-pharmaceutical naturopath. That's not at all the reputation I'd like. That being said, what I always say to my patients is I'm pro-patient. And when an intervention is likely causing them more harm than good, I always say discuss with your doctor or your naturopath, discuss with them what are some of the alternatives? What are some of the things that are shown to be effective that don't have a lot of side effects and don't actually increase your risk of things like femur fractures? So for, in lieu of using the bisphosphonates, what I often recommend, ensure you've got adequate levels of vitamin D. In fact, the average Canadian is vitamin D deficient, and lack of vitamin D can be one of the leading causes of osteoporosis and osteopenia. As well, vitamin K, specifically your vitamin K2, very important in bone growth. It's what dictates where minerals need to go. And then of course, just ensuring adequate minerals. Bone is much more than just calcium. If you have deficiencies in magnesium, which is actually considered to be the #1 mineral deficiency in Canada, a magnesium deficiency will cause osteopenia and osteoporosis regardless of how much calcium you're taking in. So if you don't take in adequate magnesium with your calcium, that's automatically going to dictate an osteopenic or osteoporotic future for you. So look at supplementing with vitamin D, look at supplementing with vitamin K, ensure that you're taking a good balanced multi-mineral. Again, more than just calcium, make sure you're getting all the minerals your system needs to properly build bone And definitely consider another alternative to using bisphosphonates, because I don't want you taking anything that may increase your risk of fracture. So I hope this video has helped you. Check out more of our natural health videos, subscribe, and if you have any questions or comments, post them below. And always remember, knowledge is health.